a number of organizations that have signed a letter expressing support for the American Rescue Plan across the state of Indiana. Jessica Frazier, I want to start with you. You're with the Indiana Institute for Working Families. How do you feel this bill would help working families across the state of Indiana?
Thanks, Dan. It's nice to be here with you today. We at the Institute have been studying how families across Indiana have been faring during this pandemic, and especially financially vulnerable Hoosiers. We've reached out to them with surveys, with opportunities to be interviewed. And what we've heard from families is that they're experiencing a lot of hardship. And some of it are folks from accommodations and food service and retail trade who've lost jobs. But some of it are folks that are on fixed incomes or adults on SSI, Social Security Disability, who haven't lost income, but they're feeling the burden of increased costs with food and healthcare and some of those strains. So we are hopeful that this rescue plan will get passed and that we will be able to support families in Indiana that are really struggling right now.
Andrew, Prosperity Indiana dealing with some of these same situations throughout this past year. How do you see this playing out? How do you see this helping if it is indeed passed into law?
Absolutely. This bill would be really critical to helping the up to 30% of Indiana's renter households that are currently at risk of eviction. These are some of the same folks that Jessica mentioned, the people who are in the retail and the hospitality and the food and beverage industries. A lot of those employees are the same low-income renters who have missed paychecks throughout COVID. And we have the saying that says that the rent eats first. And so people will pay rent and then put other bills on the back burner. And that ends up catching up to you in a recession like this. We have data that shows that up to 228,000 Hoosier households are at risk of eviction. That's about 30% of all renter households in the state. And while the previous congressional relief packages have been able to help some of them, it's only been a fraction. So this relief package would help with emergency rental assistance, but also would help with some homeless stabilization for those who have fallen through the cracks in the meantime, and then help get a step forward toward housing security in the future.
And Emily, obviously a lot of people have continued to go hungry throughout this pandemic. What is your organization seeing on the ground and within this legislation that you think might be helpful?
Sure. So our 11 member food banks that are all Feeding America affiliates are continuing to see that heightened need. It's leveled off, but it's not decreasing. We still have regular calls and everybody's seeing, a continued demand. What we are hearing from our clients is, COVID is somehow impacting them, but it may be that they're not getting enough hours. They're not getting enough to make their resources stretch. And so we're continuing to see a lot of clients continuing to come through the charitable sector. What this bill does, however, is it really props up and continues to support the federal funding and programs that do a much more robust job of serving Hoosiers who are at risk of hunger. For the 200 Feeding America affiliates across the country, for every one meal that they distribute, SNAP provides 9. And currently, about 10% of the Hoosier population are utilizing the SNAP program, the Supplemental Nutrition Assistance Program, formerly called food stamps. What the bill does is it continues some of the increased benefit levels that we've had, and it stretches those to the end of the federal fiscal year. It's continuing with the pandemic EBT that's serving kids when they're out of school, so we can continue to do that into the summers and through the public health emergency. And then it's also providing some important administrative support for all these programs that have been operating at breakneck speeds, changing, amending, filing waivers that the state runs. So for instance, the State Department of Health runs WIC and FSSA runs SNAP. The caseloads, the changes, the extra programs, and the extra benefit pieces that are coming through have not had any administrative support. So it will enable the programs to run better and to be to fund the hard work that's happening on the ground by some caseworkers to make sure that those things get through.
I want to open this next question up to whoever wants to answer it. Some of the opposition to the bill has been suggesting that just 9% of the bill would actually go to COVID-related items. It sounds as if some of you are suggesting that you feel there may be more within this legislation that will help organizations that help people impacted by the pandemic that may go beyond that 9% that some opponents of the bill have been mentioning here in recent days?
Anybody want to take that?
So that is a tough question, Dan, because a lot of us in the, financially vulnerable advocacy community, we have been inundated with so much work throughout COVID. And I honestly have not really had a chance to do a full analysis of all of the things that are in this $1.9 trillion package. So what I can tell you though, is that families are struggling, and the pieces that we've talked about today, the pieces related to unemployment insurance, the stimulus package, rental assistance, food and nutrition assistance, the earned income tax credit increases, and the child tax credit increases are critical for Hoosier families right now. And, I don't want to pass off your question, but I really can't speak with authority about what those other pieces are. What I will say is that, we have lost some jobs that are not going to come back. And we are going to have some folks that are long-term unemployed if we don't also think about ways to build the economy and to bring new jobs in. And so I'm hopeful that other pieces of the plan that are not directly assistance for, these families are aimed at improving the economy, creating some jobs, and trying to replace some of what's been lost that may not come back. Also, what we're hearing from people is it's really hard to quantify whether or not you're impacted by COVID. There's a lot of mental health stress that families have been under, and you may not have experienced economic hardship, but it doesn't mean that you haven't experienced hardship due to COVID. And I think there are some pieces in the plan that speak to some of those things as well.
And I would add to that too, when we're looking at these programs assisting hunger relief, I know there were some new jobs numbers that came out today. I know our unemployment level has been low, but if you're looking at, what we expect the U6 numbers to be, and Jessica and Andrew can probably explain that better than I can, but it's people who are unemployed, underemployed, it's, barely connected to the workforce. Those are the folks that we're seeing. And we know from, and I'm not an economist, but economists tell us that it's going to take them years to pre-COVID recession economy levels for our clients. The estimate right now that we're hearing is it's going to take them 5 years, our clients, to be able to have the resources they need for their families. We saw that with the Great Recession, and so what this package does is it's an economic stimulus package, which generally speaking is going to help our clients by helping the economy grow to where it's maybe going to start to bring them along with it.
And we should note too, it's not just about a lot of us not being able to read the full bill yet. It's also a matter of not really knowing in terms of what programs are and are not being included in that conversation about what's in the 9% or other 90% of the bill right now too. Andrew, you want to take a crack at that?
Yeah, what I'd say, and I'm not sure how folks have calculated that 9%, but what I can say is that from a community economic development perspective, housing is healthcare. So, want to make sure that anyone is thinking about that rent and utility and housing stabilization assistance is most definitely directly related to COVID relief. Because when you have folks that are housing unstable who end up being evicted or homelessness, then that means that they're couch surfing and they're going from house to house or to homelessness shelters. And that's when you see community spread of COVID. This virus is still spreading throughout Indiana in all of our counties. And unless we have that stable housing through the funding in this bill, you're going to put our recovery in reverse when it comes to both public health and economic recovery.
Thank you all for your time. We really appreciate it. Any final words for anyone who wants to add something else before we go?
Look forward to see what we have to say, how relevant it is by Sunday, by the time the bill is maybe passed.
Yeah.
We'll see what happens. Yes. All right. Thank you all. I
Thank you so
appreciate
much.
all your time
Thank
today.
you.
Thanks,
Thank
Dan.
you again.
All
Thanks.
right. Bye-bye.
Bye.